If I could ask, ladies, if you would mind staying right there. We have a couple of minutes. If you would raise your hand, and I'm looking for our helpers with the microphone. So if you would raise your hand when you have a question, just please tell us who you are, where you're from, and ask your question. We're recording the events. I should also tell you that Mike's presentation will be posted to our website just as soon as we're able to, and you could access that. That's easy. Just put in population health. You'll come right to it. So once again, tell us who you are, where you're from, and ask your question, please.
My name is Blaine Workentine. I live up in Collegeville. And David Nash and I have had a bit of a history together. Very great talk, but I just wondered, are you looking at this as a competitive advantage for Humana, or do you look at it as like an open source type of process? Are you looking at the community in a more holistic fashion?
It's a mixed bag. I'm clearly going to find business opportunities in all this, but for example, the pedometer program I just talked about, that's open to anybody that wants to do that. And a lot of those people I just talked about are not part of our company. So, you know, that's a struggle for all businesses to figure out how open to be with all this. I mean, if I found the holy grail embedded in all this relative to changing behavior, you know, it could be an incredible behavior, you know, or a competitive advantage. But gosh, as a society, you'd like that to get around if you find something in here. So that's going to be a struggle. And some of the testing things we're going to do, we have relationships with 3 different university teams on the whole behavioral economics group, and they're going to be establishing some tests and all sorts of projects around the company over the next couple of years. We've had to deal with that right out of the box. If they find things and as they learn things, who publishes that, whether it's public, whether it's open, you know, all that's in front of us. And so there's no black or white answer to that. But clearly, our current attitude is we're probably going to be pretty open with anything we find here and just try to continue to be quick and nimble and stay ahead of people. We'll see.
It's a great question. Tough issue. Yeah. Other questions? So we have microphone again. Tell us who you are, where you're from.
Hi, Dr. Roseanne Shaw from Thomas Jefferson University. Thank you. A very interesting and forward-thinking talk. Love your focus on wellness, and I echo Janice's perspective about your focus on occupation, the importance of keeping people engaged, and independence. But I want to ask a question from a personal perspective. It's about my mother-in-law, for example, who is 15 years post-stroke, and we can't keep her in her home, although she could be in her home and be independent and be perhaps live longer, but we're not able to get the supports from the insurance companies to do that. So I just sort of contextualized it in a story. I wanted to hear from you what we can do to move policy and payments toward this independence and occupation and self-reliance that we would like to do as occupational therapists and other healthcare professionals with individuals to keep them healthy and keep them living longer.
Great.
Well, so I can't answer for every insurance company because there's thousands of them and they all think differently, as you all know. But, you know, I think the business model is part of why you're in the picture in, because there's no economic model outside of a Medicare Advantage kind of environment where there is a prepayment and a motivation and a structure to keep that individual in their house. Outside of that, the industry has no good way to get at that. So I can tell you there's going to be huge advances on keeping people in their homes. I sat through a 2-hour presentation by Bill Gates personally on what Microsoft was trying to do to build a business around what it would take to keep somebody in their home through digital monitoring of this, that, and the other, and virtually everything in a house can be digitized. So the capacity to do it is coming. The business models are limited and only in a couple spots that would even support that idea. And even Microsoft, with everything that they can dream up and everything they can do, cannot find a business where somebody will pay them for purposes for doing that. So we got all sorts of gaps and holes. And you know, the thing I feel pretty good about is because we're big into Medicare Advantage, we're one of the few players that actually has a motivation to try to figure that out. Because the last thing we would want is your mother bouncing in and out of hospitals and institutions of any kind. So, because if somebody was to ask me, what is Humana's strategy? And it's really simple. Keep people out of institutions. What is it going to take? And we have to be ready to pay for whatever that takes because it's always less expensive.
Wow. Well, and don't forget we got a 610-bed institution across the street. Yeah.
I told you I was going to aggravate at least half of these people before I left.
It's okay. We know that's the righteous way to go. Okay. Rob Simmons.
Yes. Thank you. Rob Simmons, Public Health, School of Population Health. Thank you very much, Mike. I was intrigued that you had one slide on health literacy. And nowhere in the PPACA is health literacy explicitly discussed in any detail with patient education and activation. Could you talk a little bit more about that and what can healthcare systems do? You know, it's not just the providers, it's how do we get our patients and our consumers activated? And I was really pleased to see that you had a slide on that topic.
Yeah, it's another, everything we touch on is hard to do. I mean, if you go to WebMD, which is one of the busiest places in theory where somebody might go to learn about healthcare or disease or whatever, the truth is that's written at a level that's way above the average American, way above it. And so, you know, we've struggled with how do you share information, get it down to newspapers are at about a 5th grade level, probably got to be about there if you're going to be able to communicate. How do you not speak, you know, medical lease, whatever it is, speak English to people. We've done things like we have a statement that goes out every single month to all of our Medicare people, and in the back of it, believe it or not, is a couple of pages, and most of them are taking 7, 8, 9 drugs. It actually shows their drugs. It has the picture of the pill, and it describes in English next to it what it's for. So it says, this is for your heart. And then it shows whether it's been bought. So it's got a whole thing. It shows what doctor wrote it. But the reason we did that is because the seniors, for example, think of all their drugs in terms of colors and days. And they generally are not real clued into what they are. And the other thing we were trying to get them to do was to take that sort of paper EMR in a little way to the doctor's office. So for the very first time, the doctor could see every pill and every prescription this individual is getting. So we're trying to find ways to make this stuff real simple in terms of how we talk to them. And I think everybody's going to have to figure out how to do that and just know what you're dealing with. And for example, under the Part D Medicare program, remember all the conversation, isn't it complex? Congress should never design benefit plans. Well, that's part's true. But it's got donut holes and all sorts of stuff in it. Well, we took all from our perspective, all the insurance language sort of off the table and said, okay, this is step 1, this is step 2, this is step 3, and then we built technology to show them exactly with an arrow, you're right here. I mean, you just have to go at it that way because we're not going to suddenly have a bunch of educated folks. So I think it's a combination of real basic things. I think the information technology world is going to get better at this. We have people coming in now trying to help us even further speak English to people. And so it's going to be a combination, but that one is really heavy lifting. It's going to take a while.
Take one more question, please.
Tim Lidke, an actuary with Navigator Benefit Solutions. Thank you for your talk, Mike. I appreciate it.
I didn't insult actuaries, did I?
Not in the least.
Oh, okay.
Not yet.
We're not finished.
One of the observations, you made a great presentation about Humana being focused on lifelong well-being. Right. And there was a great slide up there where it had basically a 4x3 matrix of health, security, purpose. And the focus of your presentation was very much on kind of the upper left two pieces. Can you speak a little more about kind of the lifelong well-being more from an expansive model in terms of talking about some of the other aspects?
Yeah, we're trying to figure out all those things at this point. We've been at it about a year and a half. But I'll give you a perfect example of things you would never think of normally. Let's do a simple thing. Administrative simplicity and eliminating paper. With all these interactions with people. If you ever walk through a claim center or a customer service operation at some health insurance company, it's a nightmare. Paper everywhere, and now that's beginning to go away. But part of it is because people either want it or some regulator said you have to do it. But there are choices to be made, and people can make those choices. So one of those well-being things up there was a sense of community. So we have an ability through interactions with people to say, okay, well, by the way, you're a diabetic between the age of 60 and 70. Let me hook you up with a group that's just like you. And so you can facilitate them getting into groups. You can provide people choices that make them feel pretty good about what they're doing. I mean, let's do the climate change thing again. Okay, I want you to go from getting paper for me to doing electronic communication for me. And you're 69 years old, whatever, it could be any age, doesn't really matter. I will give you something if you will make the shift. Now, what's likely to move somebody, and this is where some of this testing gets interesting, if you'll move to electronic, I will plant a tree for you. That's gonna appeal to certain people. I will give you $4. That appeals to somebody else. I will make a donation to St. Jude's Hospital. That's somebody else. And so thinking through, you know, what people like, how they feel, and how the company has a relationship with them is built on all these little moments around the idea of meeting someone where they are and finding what that concept of well-being actually means to them. And those are just simple little examples, and there's bigger ones I can come up with, but we're working through all those areas trying to figure out what would it take to have a relationship here built on this concept. What products would go in there? How would services change? How would communication change? What choices should these people have? So it's really, I mean, we're still scratching our head a little bit ourselves as we try to put meat on these bones, but it's on all those areas, and there's hundreds of them. So it's exciting to think about, and I don't know exactly what the business implications are. I've got a few things cooking, but we have a group of folks. We have an innovation center with 30 some odd people that, you know, that's what they do. So every day they wake up, all right, what are we going to do? So
Wonderful. Mike, if you'd stay up here with me. So first, one more round of applause for the panel and for Mike. Let me take a moment before we adjourn to acknowledge the hard work of a couple of key people, most especially Alexis Skoufalis, Janine Kinney, the entire education team in our school. I also want to recognize the dean's staff, Neil Goldfarb, Caroline Golab, David Glatter. These are people who, without their support, we never would have gotten to where we are today and the ability to celebrate our 3rd birthday in July. I hope you'll join us on June 2nd when we graduate the 2nd cohort of graduates from our school on the stage of the beautiful Kimmel Center. It's the only way I'm ever going to make it to the stage on the Kimmel Center. And I hope you'll be there to witness and participate in their joyous day. Also hope you'll come back on July 21st, Thursday morning, 8:30 to 10:30 in this room. We're going to share with you an update on our progress over the last 3 years and where we hope to go strategically with the school. Finally, I know that Ray and Doris, as Mike Vergeer noted, couldn't be here with us today, but I would be remiss if I didn't publicly say a big thank you to Ray and Doris, who have been incredibly supportive of our school and, of course, of me personally. Wonderful. Sometime you ought to visit Ray in his office practicing medicine at age 89 in Reading, Pennsylvania. That'll give you a glimpse into where we were, and today was a great glimpse into where we're going. Ladies and gentlemen, thanks for coming. We stand adjourned.